With ongoing concerns over the COVID-19 pandemic, it's hard for other public health problems to gain as much attention. But a recent study found that in India, more than 1 million people have died from snake bites in the last 2 decades. Many happen this time of year, which is monsoon season. Globally, someone dies from a poisonous snake bite every 5 minutes, and another 4 people will suffer a permanent disability. While researchers work on finding new ways to produce antivenom to help treat poisonous snake bites, in some parts of the world, mainly in Asia and Africa, snake bites remain a daily and deadly risk. Special correspondent Benedict Moran and video journalist Jorgen Samso reported this story last year before the coronavirus outbreak. A warning, some of the images may be disturbing.
In this hospital in eastern Nigeria, doctors are receiving the first patient of the day. 19-year-old Pwagrija Samson was bitten in the foot by a carpet viper. It's a small, aggressive, and highly venomous snake that is common in this part of the country.
I was in the field and walking to go to the toilet, and I stepped on a snake and was bitten. Now I'm having a lot of pain where the bite is.
This hospital isn't an ordinary one. It deals exclusively with victims of snake bites, and Samson is a typical patient in typical danger. Venom from a carpet viper prevents coagulation, and without treatment, he could bleed to death. Samson first treated his injury at home in his village using traditional remedies, but after 2 days, the bleeding continued, so he traveled more than 100 miles over difficult roads to come here. Now his foot is severely swollen.
There's swelling already, so the tissue is compromised. So if there's an infection, the infection can just set in rapidly, much more than in a normal tissue.
This is the only hospital of its kind in sub-Saharan Africa. Demand for its services is strong. We've only been here at the Kaltungo Snakebite Hospital for about 30 minutes, and within that time, 3 patients have been admitted here. Globally, around 120,000 people a year die from venomous snake bites, according to the World Health Organization. To put that in perspective, in 2018, more people died of snake bites than were killed in war. India and neighboring countries in Asia have the highest number of fatalities. In Africa, the highest caseload is in Nigeria. At least 10,000 people a year here are bitten. 1 in 5 of them die. Many more deaths and injuries go unreported. So says Dr. Abdul Razak Habib of the research coalition known as the Global Snakebite Initiative.
Only about 8% of victims of snakebite go to a formal hospital, meaning over 90% are faceless. No one knows them. No one has seen them. If we are not aware of them, how can we speak for them?
Habib says snake venoms can contain numerous proteins, enzymes, and toxins that not only prevent blood from coagulating, but can also destroy cells or cause blood pressure to plummet. They also can disrupt signals in the nervous system, causing muscle paralysis. The WHO recently moved snakebite poisoning to the A list of neglected tropical diseases targeted for elimination.
In contrast to the rest of the neglected tropical diseases, snakebite is the greatest killer. Many of them, they may leave you disabled. You may be diseased, you may be ill, but really they don't kill. You know, snake bite is the one that really kills, and it kills within very short period of time.
Here in Nigeria, farming is the main source of income.
Snakes are often found in fields, just like this one, places where families are also cultivating. That's why snakes are so dangerous, especially for children.
In the fields just behind the hospital, Marlon Della shows us where the small but dangerous carpet vipers live.
The smaller ones are more dangerous than the big ones and have more venom in them. To make antivenom, we use a lot of the small ones.
Antivenom is the only effective therapy against a venomous snakebite, and it's important to use it quickly. Delay can be deadly. The Nigerian government usually supplies antivenom to Kaltungo Hospital for free, but doctors here say they are overwhelmed by patients, and the hospital's supply has run out. A representative from the State Ministry of Health told us that its budget for antivenom isn't big enough to meet demand. That means the patients have to buy it themselves at a private pharmacy nearby. Each vial costs around $100 US, and the standard dosage for successful treatment is 2 vials. That's a huge expense when half of the country's population survive on less than $2 a day. There's also a worldwide shortage of antivenom. The WHO says only half of the antivenom needed globally is currently being produced. Adding to this problem, several pharmaceutical companies have recently stopped the production of antivenoms specifically intended to treat some kind of snake bites found in Africa. The reason? Snakebite victims are mostly found among the rural poor, which means there's not a lucrative market for those producing an antidote. Mwele Malecheda is the WHO's director of its Department of Control of Neglected Tropical Diseases.
There were groups that were producing antivenom in the past, but then the motivation and the motivation to produce it, given the market base, made it impossible for them to continue doing so.
Across Africa, faced with a lack of affordable, accessible antivenom, victims often try home remedies. In South Sudan, 10-year-old Awiang Magwar is having surgery at a hospital run by Doctors Without Borders. She was bitten by a puff adder, another deadly snake, while sleeping. Her uncle says they tried a wide assortment of traditional treatments.
They told us to give the child a raw egg. Then they cut half a frog and put it on the wound to stop the venom spreading in the blood. We also gave the child a potion made of ground seeds and leaves. We tried all these things, but there was no improvement.
Nearby is Nyandeng Goch. The 60-year-old was bitten while farming. She, too, first relied on traditional medicine.
The wound was bleeding, and I called my relatives to come and help me. They came and they dug a hole, and I put my foot inside the hole for 2 hours, and they buried my foot with soil.
Dr. Habib says these remedies don't work against venomous snake bites.
If anything, is harmful. Delay is a major predictor of dying. If you delay either through seeing a traditional herbalist or through some other means, or you are using some local remedy, that delay could be adverse, in the sense that it could lead to more complications or even death.
But often people have no choice. Nigeria doesn't produce antivenom. The country lacks the expertise, production facilities, and funds. Instead, it buys it from companies in the United Kingdom and Costa Rica, which create it through a process that includes injecting sheep and horses with venom and harvesting the antibodies the animals create. Back at Nigeria's Kaltungo Hospital, head nurse Abba Abese is monitoring patients closely.
We are telling them the position they will maintain for treating the patient. They should not lie on the affected leg because it adds pressure and is always painful, and the swelling will increase.
One of her patients is 12-year-old Abubakar Dahiru, who was bitten while tending cows. He's been in the hospital for 7 days. His parents are worried after nurses administered an unusual amount of antivenom. He has needed more than the usual 2 vials.
On arrival, he had this anti-snake venom given to him. The following day, it was repeated. The following day, repeated again. This is the 4th one.
Dahiru's bite won't stop bleeding, so he also had several blood transfusions.
Because of the open wound, the bleeding is everywhere. The anti-snake venom will not be enough for him too. It's overdiluted and is oozing out, so he has little in his body, cannot contain him. So another one has to be added again. So like that, because of the continuous bleeding, there is the sign of improvement now compared to when I came early in the morning.
The World Health Organization recently labeled snakebites an epidemic and made helping snakebite victims a high priority. It has launched a roadmap to cut in half death and disability by snakebites by 2030. It includes a push for more research on snakebite treatments and funding to help countries stockpile antivenom.